This video is the first of our series where we have a patient testimonial. This particular patient came to us with a pain in his left thigh. Unfortunately, he met with an accident 2 years back in Bangladesh, and he went through a major procedure where multiple bones are operated, and he had a tough post-operative period where he had a delayed rehabilitation, movement was delayed. He was an advocate by profession, he was not able to carry on his routine activities. All was going on for the last 6 months. But unfortunately, even at the end of 6 months, he had some difficulties when the doctor found out that one of the bone is not healing as expected. It was his left femur bone for which they had done a plating.
আমি অ্যাডভোকেট বিকাশ কৃষ্ণ রায়। আমি বাংলাদেশ ময়মনসিংহ ডিস্ট্রিক্ট থেকে আসছি। আমি রোড অ্যাক্সিডেন্টে আমার পা ভেঙে গিয়েছিল। প্রায় 20 মাস মিন্স 20 মাস আগে বাংলাদেশে আমি একটা অপারেশন করেছি, প্লেট বসানো হয়েছিল। তারপরেও কী কারণে আমি ব্যাড লাক, আমার হাড়টা জোড়া লাগে নাই, আবার প্লেটটা ভেঙে গেল।
So he went to multiple doctors, he tried the hospitals next to his hometown, and then he went to Calcutta, then he went to Bangalore, and finally through one of his friends, he reached us in MGM Healthcare here in Chennai.
আমি আমার ফ্রেন্ডের মাধ্যমে রূপেশ কুমার ওর কাছে শুনতে পাই চেন্নাই মাদ্রাস শহরে MGM হসপিটাল, ভেরি নাইস অ্যান্ড ভেরি ট্রিটমেন্ট অ্যাগ্রেসিভ। আমি রূপেশের কাছ থেকে শোনার পরে রূপেশ বলল যে ঠিক আছে তুমি আসো, MGM তোমার জন্য অপেক্ষা করছে। ও আমাকে এয়ারপোর্ট থেকে নিয়ে আসলো।
So when we analyzed him, he had severe pain in his left thigh. The surgery has been almost 18 months before when we saw. When he reached to us, we were in a scenario of examining him, and we found out that he had significant pain in his left thigh, and the surgery was almost 18 months from the date that we saw him. So it is definitely a sign that the bone has not united as expected, so we term it as a non-union. But the only good information was he had no infection. We had to run a battery of tests to find out the reason why it was not healing, and there was no infection. Once it was done, we were prepared. We counseled him saying that this particular surgery which they did had failed for unknown reasons. We cannot blame anything on the previous surgery or the surgeon, but for unknown reason it had either a long post-operative period.
কারণ আমি 20 month ago বাংলাদেশ অপারেশন, তো 20 মাস আগে যে অপারেশনটা বাংলাদেশে আমি করেছি ফুললি ডিফল্ট সার্জারি, বাট MGM এ এসে নিউ লাইফ, কামিং নিউ লাইফ।
So now we had an option of redoing the whole thing and then making him back to get back to his routine. So he is a single person in his family who is an active person who is involved in making money for his family. So he has to get back to his livelihood. So we offered him to do a procedure called revision nailing. So here we did 3 procedures together where the old implant, the plate and the screws were removed. Then we had to go through the marrow in the bone and do a nailing. And finally, to make the healing 100%, we had to take his bone marrow, the stem cell from his hip joint, and we placed it in the fracture site to make it healing faster. The quality of the bone was so good, so we were more sure that this time we will probably have a definitive healing. So the major trick in this particular patient is because the healing is almost done but it's not complete, we had to recreate the healing process. So there is a process called freshening up the fracture fragments, where after removing the implant, you see the raw bone, make multiple drills, clean it up, make sure that the blood flows naturally there. Only then your stem cells can enter that part and make the healing possible. So we did all this and we were very confident his bone will heal. We made him walk on the very first day. For the first time, he walked without pain on second post-operative day.
আনার পরে আমি এখানে ফার্স্ট যে আমার লাইফে যে দেবতার মতো কাজ করলো, যে গড, আমার লাইফ গড, তো ডাক্তার শ্রীরামকৃষ্ণ মূর্তি স্যার আমাকে দেখেই বলল যে এটা আপনার আবার নেল সার্জারি করতে হবে, আপনার এটা ভেঙে গেছে, এটা রিমুভ করতে হবে, ভিতরের যে সকল প্লেটগুলো আছে, নাট বল্টু যেগুলো আছে সেগুলো আবার এখান থেকে সরে নতুন করে নেল সার্জারি করতে হবে। আপনি ভয় পাবেন না, ঠিক হয়ে যাবেন আপনি।
And he was there with us for almost a month, in which at 14 days we removed the sutures. By 1 month we took an X-ray, we found it very good uniting signs are there. So we made him more active. We started some exercise, physiotherapy, rehabilitation, and he was very, very comfortable after almost 2 years since the first accident. So now he's back to Dhaka and he's very happy this time, and hopefully he comes back next time not as a patient but as a happy individual. So this particular patient is an example that if you have a failed surgery, that doesn't mean it's an end of the road. You always have an opportunity to make it better, reach the right hands so that they make you better, and you'll get back to your routine day-to-day activities. Thank you.